We know that boys have a higher prevalence than girls at a rate of 19 versus 15%. And this pattern is also observed in Latin America and Caribbean region. In Guyana, self-harm is tragically the leading cause of death in adolescence for both boys and girls, 15 to 19 years. And overall, suicide is the second highest. So we have the second highest suicide burden in Guyana in the Americas. So this is something that we often hear about in the news, but not all cases make it to the media, especially those from rural communities. And in Guyana, we still have lots of stigma related to mental health, which deters young people from seeking care. Also, our mental health services are largely concentrated at the regional hospital level in Guyana. So that's, in most regions, one health facility per region that has mental health services. So there are limited community-based options available. And we also know that adolescents that have a disability are at heightened risk for mental health challenges. So we also need to pay close attention to this group. So our goal with this mental health program is that in 12 months, 6,500 adolescents aged 10 to 18 years in Region 2, including those with a disability, will have improved coping skills and mental well-being in supportive environments through increased access to quality mental health and psychosocial support services. So the program has two outputs. Output one is increased access to community mental health services. And we will achieve this by establishing adolescent mental health services at primary healthcare facilities. So primary healthcare facilities are located in communities. So it takes services closer to the people. And we will ensure that the services are inclusive by supporting the establishment of ID cards for persons with disabilities so that they can receive priority services. We will also promote those services and promote mental health care seeking behaviors to ensure that the adolescents are using those services. And that will include, the promotion will include activities like a community engagement activity for adolescents with art therapy and fun physical activities. So output two is the strengthened capacity of teachers and peer educators to support adolescent mental well-being in schools. And this would be achieved by building the capacity of guidance counselors and in-service teachers in social and emotional skills building and early detection of mental health conditions. We will also support the revision of the pre-service teachers curriculum to ensure that we are strengthening the system and having sustainability of the work that we're doing. And lastly, we will empower adolescents by building the capacity of students to enable, of peer educators to enable supportive environments in the schools. So this partnership with Republic Bank would achieve one, increase in access to adolescent mental health services in communities. And this would be through the establishment of inclusive services at least 3 primary healthcare facilities in Region 2. It would also see the training of 15 primary healthcare workers, ensuring that they have demonstrated improved skills and knowledge in mental health and psychosocial support. It would also see that at least 30 adolescents are directly reached who access services, and also at least 6,000 adolescents who are reached with information on care-seeking behaviors and coping skills. So this partnership will also achieve strengthened capacity of educators with the training of 25 guidance counselors and teachers, 20 peer educators, and reaching at least 15 adolescents through school clubs. And it will also see the revision of the pre-service training curriculum. Thank you, and we're looking forward to a successful partnership.
We are happy to have with us strong leadership from the health sector. UNICEF has been working closely with the Ministry of Health to strengthen mental health services and systems in Guyana, mainly building the capacity of frontline workers and promoting greater awareness and early intervention for adolescents. This continued collaboration has laid an important foundation for expanding access to quality mental health care and ensuring that young people receive the support they need. I now invite Dr. Griffith to deliver her remarks.
So I'm Dr. Griffith. I'm the doctor attached to the Adolescent Health Unit, and I'm here on behalf of my director, Dr. Ertanisa Hamilton. She's the Director of Primary Healthcare Services across Guyana, of which the Adolescent Health Unit is a part of. Now, in the Adolescent Health Unit, we work in the fields. We work in the clinics, we work with in-school youth, either in collaboration with or in support of the Ministry of Education. And one of our main priority areas is adolescent mental health, specifically because adolescence is a particularly difficult time where there is not only physical development, but brain and psychosocial development. And with this brain and psychosocial development, we can expect in a changing world, in changing times, it is extremely challenging. And we have seen our youth crying out for help, if not with their actions, if not with their behaviors, if not with the statistics, from their teachers, from their healthcare providers. We see evidence of it at the hospitals, at the clinics, when they're coming with anxiety and depression. And it is really something that's very close to my heart, makes me emotional. But we have been receiving so much support from UNICEF, and they help us to put our policies into practice. And as one of their main implementing partners, we see each other quite often. We see each other quite often, and with this partnership, it makes me elated because it lets me know that we have support to help to continue to do the work that we've been doing. And health cannot happen in isolation. The Ministry of Health cannot handle health by itself. And youth need more than just support from the healthcare system. And this public-private partnership is what will enable us to continue to do the work that we've been trying so hard to do. I know Republic Bank is no stranger to youth engagement and youth empowerment. I have been a beneficiary of some of Republic Bank's youth engagement. I was actually a part of the steel pan, the little steel pan thing that you guys did when I was an adolescent. And so these are all multi-sectoral things and a multi-pronged approach that you are taking to help empower and engage our youth in positive ways that I am so happy about. I'm elated and I am happy about this partnership, and I can't wait to see what else can happen, what else can come out of this. Thank you.
Republic Bank has shown a clear and consistent commitment to supporting initiatives that strengthen the lives of children and adolescents. It is my pleasure to invite the Managing Director of Republic Bank Guyana Limited, Dr. Tusan Boyce, to deliver his remarks.
You know, I have a prepared speech, but I'm often tempted to divert from it and deliver something from the heart. And today I feel that way. But the better part of me says, stick to the speech. I will, however, start with a bit of a story that's not on my speech. When I was a young man, I grew up in a village called Belfawaktin on the east coast of Demerara. It's not in Region 2, it's in Region 4. And I remember going to the local health center. And on the wall, as a child, I remember this because I used to read it and think a lot about it. There was a definition of the word health. I don't know how many of you have ever seen these in one of the old health centers. I'm not going to aid you by asking the question. You don't need to put your hands in. But it said, as far as I recall, health is a state of physical, social, psychological, and mental well-being. I remember it, even as a child. Because I always thought of it as a child as being a state of physical well-being. And too often I think going through that phase in life, it's important for us to question, even as we do as adults, what exactly is a state of health? So I'll now revert to my prepared remarks. No, before I go there, let me touch on one other thing that's not in my prepared remarks. Today is fundamentally about power and how we use it. Power to make a difference, power to impact, and in this case, the power of partnership. Today we formally launched this important adolescent mental health initiative in partnership with UNICEF and our valued stakeholders. It marks the beginning of a meaningful partnership and a shared commitment to strengthening the mental health and well-being of our young people across Guyana. Yes, you can clap for that. At Republic Bank, through our Power to Make a Difference program, we are deeply committed to initiatives like this that create a lasting and positive impact. Can you hear me well at the back? Yeah, I lost the battle last night with NyQuil. I took too much of it for what I thought was just a little irritant of my sinuses, and realized this morning maybe the NyQuil was too much for me. But here we go. So there is no greater investment than in the well-being of our adolescents. And I'll repeat what I said earlier, that at Republic Bank, through our PMAD program, we are deeply committed to initiatives like this that create a lasting and positive impact. Our young people in particular need the support that we provide and that this partnership will provide. When our young people are supported, our families are stronger, our communities are stronger, and ultimately our country is stronger. And I say this because, again, I depart from my prepared remarks. Since I started my tenure here in October, I was honored to be in this room and present at one of our other Power to Make a Difference programs in the context of area of youth football. And what I would like to see going forward is that we begin at Republic Bank to tie these together. Tie youth, our involvement in youth sport, with our involvement in financing of youth mental health. We can make it happen. We can help to resolve what we heard earlier about the stigma by making it part and parcel of what we do. In football, we wear armbands and we wear things that would help to support, different causes, and we can do this for mental health as well. We can have the Republic Bank Mental Health Football Cup or whatever it is, but we can tie these things together in a way that makes sense. In the interest of time, though, I'll revert to my remarks. Yet, despite its importance, mental health remains one of the most overlooked aspects of development, and by this, I take that to mean human development. Too many of our young people face challenges silently, unsure of where to turn to or how to ask for help if left unaddressed. These challenges can have long-term effects on their growth, opportunities, and overall quality of life. By focusing on Essequibo in Region 2, Pomeroon Supernam, my wife would have been very proud. This is a part of the country that she's from. We are taking a deliberate step toward expanding access to youth-friendly, community-based mental health support, meeting young people where they are, and equipping those around them with the tools to better support their well-being. What makes this initiative particularly impactful is its holistic and inclusive approach, strengthening primary health care services, empowering teachers and peer educators, and creating safe spaces, both in schools and within communities. It also ensures that adolescents living with disabilities are not left behind. I was particularly pleased to notice that, reinforcing our shared commitment to equity and inclusion. We are proud to stand with UNICEF Guyana, with support from the Ministry of Health, the Ministry of Education, and National Disability Commission. This collaboration demonstrates what is possible when we come together with a shared purpose in support of SDG 3, which has to do with good health and well-being, and work towards a healthier future for all. To everyone here today, I continue to encourage us to create environments where our young people feel safe enough to speak, supported enough to grow, and empowered enough to thrive. To the young people who will benefit from this program, know that your voice matters. Your feelings and seeking support is not a sign of weakness, but one of strength. On behalf of Republic Bank, I commend all partners involved for their vision and dedication. We look forward to the meaningful impact this initiative will have across Region 2 and in time across Guyana. And let me finish from the heart. I think the power that we demonstrate today in partnership and Republic Bank being able to support this with financing will go even beyond this program. And it will go and touch lives in ways that will deliver meaningful and lasting impact. And it's important that we recognize that just as we heard the previous speaker indicate that she was a part of a Republic Bank program having to do with steel pan, we want to be able to be part of those lives we can celebrate many years later who will say, I benefited from a Republic Bank funded, UNICEF partnered program that helped deliver mental health support that met me where I was. And I say it's very important, I think, for us to recognize that, because I want to end with an encouragement about how we think about these projects going forward, these opportunities for collaboration. Let's think about how we can creatively redesign them to ensure that we deliver maximum lasting impact in as many areas as possible. So I'd be really happy if the next time I see an opportunity for us to partner with UNICEF or another similar organization, we also think about other areas where we can deliver a similar impact and use our power to tie them together. Thank you for your time and attention.
It is now my pleasure to invite the UNICEF representative, Mr. Javier Cordoba, to share his remarks. Under his leadership, UNICEF continues to work closely with partners across Guyana to advance the well-being of children and adolescents, including strengthening systems that support mental health and resilience.
Managing Director of the Republic Bank, Dr. Boyce, Dr. BDP from the Adolescent Health Unit, members of the National Disability Commission, representatives of the Ministry of Education, members of the teams of Republic Bank and UNICEF, dear guests. Good morning to all. It's really both a pleasure and a truly honor to join you today for this important occasion, which is nothing less than the formalization of this new partnership between UNICEF and the Republic Bank Guyana to advance mental health and well-being for adolescents across the country. Today's signing represents far more than an agreement. It reflects a shared commitment to ensure that every child and young person is supported, heard, and empowered to thrive. In Guyana, as in many other countries across the world, adolescence is a time of immense opportunity, but also vulnerability. Young people today are facing a wide range of complex challenges, from academic pressure and social expectations, to family stress, loneliness, bullying, uncertainty about the future, and the growing influence of digital spaces, all of which can sometimes become a heavy burden for them. Across the Caribbean, we know that too many adolescents struggle in silence. Stigma, limited services, and lack of awareness often prevent them from seeking help. In Guyana, strengthening systems that support adolescents' mental health is therefore not just important, it is also very urgent. This is why partnerships like the one we celebrate today matter so deeply. It builds on the many important efforts already being led by the Ministry of Health, by the Ministry of Education, by the National Disability Commission to strengthen mental health and well-being among children and young people in the country. UNICEF, together with the Public Bank and in coordination with its public institutions, will work to expand access to mental health awareness, promote positive coping strategies, and create safe spaces where adolescents feel supported and understood. We also recognize that supporting adolescents means working across environments that shape their lives, schools, families, and communities. It really means ensuring, for example, that parents, teachers, or caregivers are equipped to listen, to guide, and to respond. Allow me really to extend our sincere appreciation to Republic Bank for your leadership, Dr. Boyce, and all your team, and commitment in investing in young people. Your engagement today sends a very, very powerful message. The private sector has indeed a critical role to play in shaping a healthier, more resilient generation in the country. In closing, every child and adolescent deserves the opportunity to grow up feeling safe, valued, and hopeful about the future. Today's partnership brings us one step closer to that vision. Let us continue to work together with urgency, with purpose, and also with compassion. To young people, just let me tell you that you are not alone. We hear you, we value you, and we know that the challenges you face are real. Please speak up, share your feelings, and reach out for support whenever you feel that you need it. There is a strength in asking for help, the Dr. Boyce was mentioning earlier, and there are people who care, who will listen, and who want to walk this journey with you. Thank you so much.